Thank you for the introduction. I am Ekman. I am going to present today on peace of mind and how to help ourselves help others. Now, what do I mean by that? This is actually going to be a little bit about my current dissertation research, in which I'm focusing on human service care providers and the work they do with other people. Human service care providers, that means doctors, psychologists, social workers, and in this case, juvenile jail officers who work in San Mateo County. Now, when we talk about what the work is that people do in human service care providing positions, it's very emotional. This is work where they're providing support, they're providing counseling, they're being sources of information about very delicate issues. Now, part of this is an interest because I'm a researcher. I'm looking at these ideas, I'm looking at these concepts, but there's a little bit of a deeper story here, which Dr. Doty mentioned. I was a medical social worker at San Francisco General Hospital for 6 years, and anyone who knows San Francisco General will know that this is maybe the worst job you could possibly have. It's a level 1 trauma center. There's a lot of violence. There's a lot of accidents. We serve a big catchment area in San Francisco County. We have very many indigent populations with complex issues, and yet this was the most rewarding job I've ever had in my entire life. I loved it. I loved all the patients I saw. I loved being there when they needed me. And however, there was days when I also felt very burnt out. I felt very exhausted and tired and fatigued by everything that was going on. And as mentioned in a previous talk, when we see suffering of others, we experience that suffering ourselves. This can make a big impact on ourselves and our everyday. So what I really wanted to understand was, how could I support myself? How could I support my coworkers in being able to show up every day, not just physically, but emotionally to support our patients? And as all of you who've had the unfortunate incident of a family member in the hospital know, when that occurs, that the staff are present, that they can attend to you, that they can really care and show emotion is so important. You're in a very vulnerable and afraid state. So that's really where the ideas for my research came. Today I'm going to try and give you a lot of information. I'm sorry, but I think you will enjoy it. I'm going to give you an overview of my study and then the theory that supported it, so we can really deeply understand emotion and stress. A little bit of my findings. This is all very preliminary. It's exciting because right now I'm looking at my data, starting to write it up, but there's not going to be that end slide where I say, and I found this, and I found that, and the other, and now. That's going to have to come at a later talk, maybe next year. But just to give you a basic overview here, this is the design of my study. So for the non-researchers in the audience, when we say a descriptive mixed method intervention, what I'm saying is that I not only gave people surveys, I spoke with them as well. And the title here, Developing and Reconnecting to Empathy and Meaning, which is the acronym DREAM, everybody loves a clever acronym, is really about what the training is about. So I started to design a training for human service care providers in a juvenile jail by doing participant observation, focus groups, and surveys, and we'll talk a little bit about that. Then I designed a curriculum from essentially what people were telling me. This is, again, a little small. From, again, what people were telling me. In order to create a stress reduction training, I got state approval for this training, which meant that everyone who was working there was able to work off some of the units they need annually to be juvenile justice officers. And then I implemented the training. I had 2 groups, there were 16 in total, and I gave them a 2-day stress reduction training. So who are juvenile justice officers in San Mateo? Well, this is a group of staff who work with youth coming right in out of the community. They are sometimes arrested right there on the streets and coming in, as you see here. So they're kind of getting pat down, make sure there's nothing dangerous that they're bringing in. And they work in the jail there until their court date. Occasionally, they stay there longer. There's people who are there up to a year, but most likely it's 3 to 6 months. And while they're in there, they're staying in these units here. And there's about 20 kids who can be on a unit at any time. There's 3 staff per every 10 kids. Now, when they're in these units, in these locked cells, the staff are sitting in what you see in the bottom area here, behind the desk. And essentially, other than eating and going to school for 2 hours, these youth can be locked up all day in the cell. It is the choice and discretion of these juvenile justice officers whether or not they want to bring them out, create some sort of programming for them. I mean, my hypothesis after working there was there's a huge, huge opportunity for the guards to impact the youth. These are youth who, by statistics, show us will end up in the adult system unless there's an intervention. And the interventions, when you try it on the outside, as a social worker, I know that tracking down kids can be really tough. You can go to their house, you can go to their school, but when they're in the juvenile jail, they are there and available. One of the days I was sitting there, I had an experience that a kid called into the unit. So a kid who was outside, who'd been released from jail, called in to talk to the guard, just to check in and say hi. And I thought, isn't that incredible? What an amazing and unique experience. Except that it happened every single time that I sat there. There was always kids calling in. And in fact, probation officers would show up and ask the guards, have you heard from so-and-so? I've been looking for them in the community. I can't find them anywhere. So there really is a great opportunity for connection. This is a small page from a field notebook that I took while I was there, just writing notes. And at the top you see Probation Olympics, which sounds like kind of cruel and unusual. However, I have to tell you, it was the most amazing week of the entire year for these youth, as well as the staff. A staff designed this 10 years ago in order to have youth be able to come out of their cells the 1 week there's no school and compete in tug of war and in basketball, in poetry contests. And it was just really wonderful to see how excited the staff were to engage with kids, to be proud of the kids. And it was the only time that these kids or these youth were able to interact with one another. So what were my research questions in this study? Again, it's very exploratory and basic. There hasn't been a lot of study about juvenile justice officers. There has been some about adult criminal officers as well as adult probation officers. So I wanted to know, what are the characteristics of juvenile justice officers in San Mateo? How do these juvenile justice officers describe their stress, emotion, and motivation? And how do you build a research-informed pilot training curriculum for these juvenile justice officers? So now we're going to get into theory here. And this will be, I think, a little bit intense for a moment, but I think you guys can all stay with me here. So why I'm putting in a definition of emotion in the first part here is that a lot of the training that was designed was based on this idea of how do we reduce stress? Well, we have to understand stress more deeply. So we start here with definition of emotion, and I just want to point out, the parts that are highlighted, which emotion has a very important function in our everyday life. It was designed so when something significant happens, our body knows what to do. So you think about a toddler running out into the street and you see a car coming. You grab that toddler. You do not think about it. You do not weigh in your head what might be the best action. Your emotion kind of allows you to rise up to the challenge and go ahead. Now, as I spoke of before, what happens in a setting like an emergency room is that actually we have those emotional experiences, those important things in our environment all the time. You have this patient come in, you have that patient come in, and you are having an intensity and density, meaning frequently, one after another, experience of emotion. So if there's nothing else you take from this talk today, other than this idea that emotion over-arousal, many instances of emotion, create stress, I would be very happy. And I used actually this very slide with the guards, because I went in the room and I said, who in this room is stressed out? Everybody raised their hand. And then I said, who in this room is emotional? And everybody looked the other way, right? So if we understand that actually an ability to regulate, control, and understand our emotions is what can help us reduce stress, this is a great thing. So just briefly here, burnout is what you hear when you hear about workplace stress. But burnout is actually kind of an interesting and nuanced definition. These three are actually subscales. So when you give people a burnout survey, they're answering questions on these three lines. I think it's important to look at this as cumulative. You have that emotional exhaustion, as I described, just kind of over and over feeling the pain and suffering of others. And over time, that can actually make you feel that you don't do your job well, that you're not able to achieve what you came there for. And this really reduces your sense of meaning. And when that occurs, you're not going to show up every day feeling tired, exhausted, and like you're not doing well. So you shut down. You depersonalize. I'm going to read you a quote that really describes that well in just a moment here, but wanted to give you a sense of really what burnout is about. So why then do we have these emotional reactions? What is their purpose if they're just kind of beating us down and making us feel bad? Well, they're actually designed to help us be in this middle part, this challenge response. And this is actually physiologically, meaning our heart rate, our blood, what's going on in our mind, everything in this state is distinct from this state of threat. So in challenge, we feel, I'm able to rise to the call. So there's this demand. There's a patient coming in, he's very sick, I need to call his family, I'm not sure if he'll survive. So I have resources. I know where the phone is, I know what his name is, I can look him up in the system, I can totally handle this. So I'm in kind of my optimal area. However, if I didn't have the resources, I didn't have enough sleep, or I didn't have enough training, this might be putting me in a state here of kind of fight, flight, or freeze. And that, yeah, I know, I'm timing it, thank you. And so so what happens here in this state of fight, flight, or freeze, this is more like your average work environment. It's not that one patient coming in, it's many patients coming in, and it really can overwhelm your perceived resources. So when we're thinking about what burnout looks like, it's really the chronic nature of the stress, not the fact that there's stress itself. Okay, so in my last 5 minutes, I'm going to talk with you about a little bit of my findings, just to give you a sense of what it means to do qualitative work and to have excerpts. This is an example of one of over 300 pages of documents I have from the interviews I did with all these guards. And in it, I look for really important and relevant quotes. Okay? So these were the quotes or the codes that I found to be the most worthwhile. I want to share a couple with you here. The first one will describe that state of depersonalization. So this is a man who's been in his job for 12 years. I'm just overstressed to the point where I don't even feel like I'm stressed anymore. I'm just basically numb. I say probably 4 days out of the week, I'm just numb. I don't even hear my conscience, I'm just numb. And then I leave here and I'm still numb. Is that unhealthy, being numb like this? Being so overstressed and being numb, I feel like I'm starting to forget stuff now. So that's not a good place to be in to help kids, right? Like that's not someone who's available. That's someone who really has kind of given up. I'm going to read you just one other quote here because I want to give you some findings. And this is about motivation and how motivation can be lost. And this is a man who'd been there only 6 years. You begin your career thinking that you want to save every kid, and you get to a certain point where you think, damn, is it really for the kids or is it for management? And then it's sad, but it gets to the point where you're just working for a paycheck. You have to go through so much where your heart was when you started, and where your heart was and where your heart is now. And you have to bring yourself back down. It's hard. And I ask him, are there days when you remember why you did this? And he says, it has been a while since I felt like I was making a difference, a long time now. So clearly, these folks need help. They need some ability to feel that what they do matters, that they can actually make a difference, that they can manage their stress enough to be present. And now again, I'm just showing you some preliminary findings, but to give you a sense of this population. The most important thing here I want to point out is that these folks have been on the job a long time. 4 years in a human service setting is a long time. Burnout rates and people leaving is pretty high. That's what we know from the literature. However, if you look here, 75% of people say they're going to stay 10 years. Despite that they can't feel their limbs, despite that they have no motivation, they are going to stay in that job. And why? Well, it is a really good job. It's well paying. And so the current kind of economic conditions are really changing this situation. So here's a little bit about the training that I did. We did emotional skills training, meaning identification of in the face of different muscles, the felt experience of emotion. We did an anchoring breath practice, an empathy practice where we did role playing about both how to get along with coworkers, how to get along with youth, how to really practice understanding these individuals. I did some burnout and stress psychoeducation, a lot of like what I'm giving you now. And we did a real kind of bringing back to the intention and motivation. Now, I actually designed this program with Chris McKenna of the Mind Body Awareness Project. He'd been doing mindfulness training with incarcerated youth for 7 years before we began, so it was very valuable to have his insights. This was the sign they put outside our training door on the first day. Who would want to go in there? And in fact, no one knew what they were getting into. A guy showed up with a gym bag. He thought he was going to get a heart rate stress monitor that day. Instead, we did heart practices. Now, I don't have much time to tell you about the training and its success other than to say that people really felt that they got a lot out of it. They felt they got things out of it they could use at work and at home. And currently I'm analyzing a lot of the online evaluations that were done by folks. But they really thought that, you know, it could help people who had thought about leaving before or now in the current state would stay and still be stressed out. So for future directions, I really would like to try and do this training again, not just in a juvenile justice setting, but in the hospitals where I used to work and in schools, and really help people improve their perceived resources and look at whether or not this has an impact on the youth, the patients, the students, to include everyone in that level of research. So I just wanted to thank my mentor, Dr. Jody Halpern from the School of Public Health at Berkeley, Dr. Dan Martin for having me here. I'm really, really glad to be speaking with you all. The Greater Good Center for my preliminary funding, my co-facilitator, Chris McKenna, and Chief Roy Brazil of San Mateo County. Thank you all.